And what do you think you recommend that we should do during an asthma attack, or even if we're like an observer and we're seeing somebody else having an asthma attack? What do you think we should be doing first?
So when you see as a bystander, if you have somebody who's having an asthma attack, the first question should be, or if you think it's an asthma attack, the first question you should ask them is whether they're an asthmatic, because there are a lot of other things which can mimic asthma. Choking being the number one thing, and once choking is ruled out and they're not choking on anything, if they're having an asthma attack, you can ask them whether they have their emergency inhaler, the short acting beta agonist, or people call it their emergency inhaler, a pump, in other words. If they have it, get them to sit down, get them to sit upright. Don't let them lie down. Lying down is not really great in asthma. Get them to sit upright, make their airway wide open, neck straight, and give them 2 to 4 puffs of their inhaler if they have it. If they don't have an inhaler with them and they're having a really bad asthma attack, it can be life threatening, especially in severe cases of asthma. I would call 108 or move them to the nearest hospital as quickly as we can. And again, keeping their airway clear, making sure that they are going away from whatever triggered their asthma attack is important. Okay, because the more exposure, the more reaction. So move them away from whatever it was that triggered their asthma attack, get them to sit down, transport them as quickly as you can to either an emergency or a physician's office where they may have a nebulization device.
Hmm. Thank you so much, doctor. I think that's like good. I think now like I know how to help a person who's having an attack, even though I'm not asthmatic myself, and I think that's good like prevention and like thank you.